Hi, welcome to a episode of the Cancer Now What vodcast, sponsored by Arizona Center for Cancer Care. My name is Jenny, and I am so grateful to be joined here today with you to talk about treating bilateral breast cancer, a physician and patient perspective. So what I'd like to do first is start by introducing our guests. Dr. Singhvi.
Hi everybody, I'm Dr. Arun Singhvi. I'm a practicing hematologist and oncologist at our Chandler office. I treat everything, but I'm particularly focusing on breast cancer, brain tumors, and genitourinary cancers. Thank you for allowing us to be here as a patient and physician interview.
Awesome. Well, thank you for doing it. And Hillary.
My name is Hillary Hillman. I'm here today to have an extra special time with you. I am a patient of Dr. Singhvi's, and I really welcome the chance to share our experiences together.
Awesome. Well, thank you so much for doing this. Hillary, can you help us understand and walk us through how you first discovered that something wasn't right and what led to the diagnosis of bilateral breast cancer?
Sure can. I had my annual primary care visit, and as part of that, every year I schedule my mammogram, and I went to a regular visit. So I had the mammogram, left town, assumed everything was okay because it had been, and everything had been going well. And then I got that phone call that wasn't what I wanted to hear. So, and that's what started it, and that kind of what set everything in motion.
And Dr. Singhvi, from a medical perspective, what makes bilateral breast cancer distinct, and how common is that?
So it's not as common. So let's start out with breast cancer in general. Breast cancer in general, 1 in 8 women get breast cancer. Amongst that, bilateral breast cancer, if you look at the literature, it's anywhere from like 1.6% up to about 11% of patients will have bilateral breast cancer. And it's important to distinguish that when I say bilateral breast cancer, it doesn't mean that the breast cancer on the right moved to the left. It's typically two distinct, different entities. And Sloan Kettering did this study where they were answering that very question, and only about 6% were different, or it's the same cancer. The majority are different cancers.
So you have to treat two cancers at the same time, basically.
Essentially, you're talking them through the left side and the right side differently.
Wow. And so, Hillary, when you first got this diagnosis, what went through your mind?
Well, I was in a Starbucks and visiting my son and daughter-in-law and new grandson in North Carolina. So healthcare came up on my phone, and even though it was a Friday, and I was with the nanny and the baby at the time, I went outside to take the call. So it wasn't my doctor, it was someone else that called and just said, hate to give you this news on a Friday afternoon, but here it is. So here I am, far away from home, not knowing the person I'm talking to, and not having an ability to be able to get a hold of my physician who was out of the office. So a lot went through my head, but I tend to be a person, as long as I have an action, as long as I have something to do, I do pretty well. If I'm left out there without something to do, I look to find it. So I immediately set into action. And interesting, when I look back, my biggest concern initially was, how am I going to tell my kids? You know, like, I don't want them to treat me differently. I was a single mom a lot of their growing up, and they looked to me to kind of hold things together. So that was a big piece. And then I assumed that I'd get the medical care that I needed. I didn't realize at the time, fortunately, that it was going to be as complicated as it was. So it was new to me. I'm in healthcare. I've been in healthcare. We have a primary care clinic that focuses on health, wellness, the journey of life. So it was like fortuitous in one way. It was what we had created. And on the other side, it didn't really meet my needs, I didn't think. So at that point. So just that whole process of how do I get all of this taken care of in my head and in reality at the same time. Plus, I have 2 businesses that I'm responsible for. So a diagnosis of 1 lesion, I mean, mine was 5. 4 of the 5 were malignant, which is what I heard on the phone. They aren't all the same. So I knew I was going to need somebody that really knew what they were doing to help me through that. But I also knew I was going to make it. So, my team is just everything.
So you get the call, you're thinking about what's going on, you're thinking about your family, and you're thinking about, okay, I've got this thing, I got to deal with it. What's the next step?
Right.
On a Friday afternoon.
On a Friday afternoon when you couldn't.
It was Labor Day weekend.
That's right,
so
it was.
Just like,
yeah. Well, I'm grateful that you got where you needed to be.
Thank you.
And that
Thank
you
for
are
all
where
your
you
help.
are, of course. Dr. Singhvi, what factors do you consider when you're developing a treatment plan for bilateral breast cancer?
I think, so the first is the patient, right? Like what's going on with the patient? How healthy are they? What's their age? What are their priorities? And first validating that part about this sucks. And I think every single one of my patients hears the phrase that the 1 in 8 women get breast cancer part, and there's nothing you did to cause this, and there's nothing you did to deserve this, right? It's just something that happened to you, and I'm really sorry that it happened to you. I think that's the first part we establish, and then we say, let's talk about this cancer so we can understand the pathology of it and why we need to attack these cancers differently for each of them. And it helps me as well when I go through that consult. And I think, when we first met, I had the piece of paper. I go through, like, here's where it is, here's what's driving each of these cancers, and here's how they behave.
It was really reassuring that you did that, and especially that you let me take it home.
Yeah, it's yours, right?
Yes. All at once.
No, and that's the reason.
The time.
Yeah,
yeah.
Because then you can remember how our conversation went.
Exactly.
Because then we walk through what do we need to do for each of these cancers. For breast cancer in general, how I treat a patient with triple negative breast cancer is completely different than how I treat a patient with hormone positive breast cancer. They behave differently. Triple negative is way more aggressive than a hormone positive breast cancer. And in bilateral breast cancer, that becomes a little bit more complicated, because what if one of them is triple negative or HER2 positive, and we have to talk about chemotherapy, whereas for my hormone positive one, maybe I didn't need to talk about chemotherapy. But we treat the more aggressive one and then deal with both of them for the maintenance side.
That makes perfect sense to me. And how did you feel about the proposed treatment plan after you met with Dr. Singhvi?
When I got here, so my course, because of what was going on, was a little bit probably unconventional in the beginning. So the first person I saw wanted to do chemo first, and that made me really nervous. It wasn't a conversation really. It was a very reputable place, but it wasn't a conversation. I wasn't included. I was just told it was going to happen. The fact that I had 5 things in there made me really uncomfortable that we didn't have the conversation that said, here are your options, or this is the way we could go. So I went as far down that path of, this is the chemo you're going to have. I had a port already put in.
With another provider?
In another organization.
Okay.
It was not here at all. And it was not making me, I wasn't comfortable. I mean, I was ready to go, but the fact that it was going to be inside of me, when we really didn't know what it was, for no less than 12 weeks before I would then find out, what the next course was, and then have the surgery. I just couldn't get my head around that. That was really making me uncomfortable. So much was in my body, and I didn't know how fast it was growing. I knew that a year ago I had a mammogram, I was fine, so I was just really uncomfortable waiting. And then I went to someone else, and really until the night before I had surgery, which is the course that I went first, I was still on the fence. So Dr. Murthy, on her way home, we were talking at the very last minute about whether I was going to show up at 6 in the morning to have surgery. So, and she was amazing. She reached out to each of the people that had a part in what was doing. She listened to me, heard my concerns, and addressed every single one of those. And so I ended up having surgery that next morning. So something similar is I kind of was going down the path of oncology, didn't want to go back to where I had started. And I had heard about the cold capping, and the person that I was seeing, I had some concerns, but she just basically told me cold capping doesn't work. If it did, we would be doing it in my office. And at that point, my daughter talked to Jenny. Jenny said, give me 48 hours and I'm going to find the right person. And you saw me within that week. So once I got to your office, I was ready to listen. But you did too, which made all the difference in the world. It wasn't just me listening to you, because I really, at that point, probably would have done anything you said. But it all made sense, and I knew I was part of that team. And more than once, you've suggested something. You said to me, and I've asked you about it, and you've said, well, what do you think? This is your decision. So I have from the very beginning felt like I was absolutely part of the team. So I feel comfortable with you.
And for me, it's not you're part of. You're the center point of the team.
Sometimes I don't like that role.
Yeah, fair, but you're the most important person in this conversation, right? The person who's going to go through all of it, The person who has to live with potential side effects, all of that, that's you. And if it doesn't make sense to you, then I need to make it make sense to you and come up with a plan that you want to do and are comfortable with.
Yeah, I appreciate that, and that's the way it comes across. I like facts. I like statistics. I like to understand. And I know every piece of this is, you need a lot of luck in there too, and you really don't know what the outcome is going to be. But I also think it's, and I didn't even think about this before, I also think it is so important to believe in what you're doing so that you can give it your all. And that, to me, that's just has made a huge, huge difference.
And you've been amazing. Obviously,
Well,
you've been like a trooper through wherever we are in our journey.
Well, I think we're in it together.
Yes,
I mean,
we are.
I really feel like we're shoulder to shoulder. You know, sometimes people will say, you know, you're riding a bike with somebody and you're you in the front or you in the back to get a perspective. I really feel like we're shoulder to shoulder.
Fully agree with you.
I love that.
Thank you.
I love to hear that. And really, I think it's that heart of a teacher that you go into those consults with that put people at ease, because it's not just, okay, this is what you've got, this is what we're dealing with, this is what I'm going to do. It's, this is why I'm going to do it. And that makes such a difference to people when they're going through, such a scary time. So thank you for being that kind of guy.
Absolutely. I love it. I think understanding is like, that's the part of, I think the physician role in being an oncologist halfway is just explaining to you what's happening.
Yeah.
So one of these days we need to talk about your life, because I have to worry about you a little bit too. You know, that 3:40 in the morning, I always get the results back,
Yes.
usually at 6 something, but now it's 3:40, so something's going
I
on.
wake up at 4 o'clock to work out. That's why.
Okay. All right.
So that's why.
Yeah.
You're in her chart at that early in the morning.
Right, yeah.
And you get an alert when he does something in your chart.
Well, and I don't sleep really well, and he told me it'll get better. But in the meantime, I see that before I come in, because I was so set on getting through that 12 of 12 without having a disruption. So those lab tests were really important. So that message from you in the morning, looks good to me. Always made my day.
That's amazing.
Yeah.
And I love that it correlates with your workout schedule
I do it right before I work out. That way it's like it's done, and then I can work out for
without thinking
Yes.
about worrying about
Yes.
something else. Yes.
Well, my kids wake up right after, so.
Can you explain the treatments involved in this particular case? Did she have chemotherapy, surgery, radiation? Was it targeted therapy? And how did they all work together?
So breast cancer is very multidisciplinary. So as I said, we treat based on the biology of both of those cancers or multiple cancers. So if we're doing surgery is removing that one area. Radiation will clean up that area for whatever's left over microscopically. My job really is the systemic part, which is worrying about everywhere else. And that's where chemotherapy, hormone therapy, and targeted therapy. Without delving into your particular scenario, I think when we treat HER2 positive disease, we treat with targeted agents for HER2. If we're treating triple negative, we treat with immunotherapy on top. Then on the maintenance side, once we're done with the more aggressive stuff, we do hormone therapy and we do newer agents, particularly if there's genetics involved, or if they're higher risk, we add in other pills like something called CDK4/6 inhibitors that previously we only used in metastatic breast cancers. So every tool that we can get to maximize our chances of not dealing with this 3 years, 5 years, 15 years down the road, we will take advantage of, as long as it doesn't make your life miserable.
So it's quality of life, throw everything you can at it
Correct.
to keep her healthy and feeling good for as long as humanly possible.
And thinking about you, like in 2040 and 2050 and 2060, not just 2026.
Yeah, that's perfect. That's very smart, because there can be lots of, people always talk about this, like when they're in remission, cancer's not over. There's always more, in survivorship, there's always more that you have to deal with. So I love that you're thinking about that for people.
Well, and as the patient, I think in terms of there's always research going on and there are new things that are happening, and what we have today we didn't have 5 years ago. So I figure if I'm going to have to put up with some of those side effects, maybe I won't have to so long. Maybe something else will come out.
And it will.
Yeah.
It will. Things
So
will change.
That's kind of a positive in my head. Yeah. It's just like, okay, I just have to hang on until something else comes up.
Fair.
What, Hillary, has been the hardest part of treatment for you?
Well, that's a really good question. I'm usually in control of myself and my surroundings. that not knowing what the next side effect's going to be, how long it's going to be, whether there's more coming, just all the unknowns have been hard. I mean, I've been incredibly fortunate. I sit in there for an infusion and I'm looking around, and I know that I have been fortunate. The side effects, have been manageable always. I've been able to work except for the day of the infusion. I mean, that's incredible. So I know that I'm fortunate. I just don't feel like me. I'm functional, just not me.
And Dr. Singhvi, how do you help patients manage the side effects?
So I think transparency is important. For me, like you telling me what side effects you're having is important. We talked at the first part, I said, most everything side effect-wise you have, if you tell me about it, most of the stuff we can fix, as long as you tell me about it. And we can, and I think the chemo may not have changed, and the treatments, some of them have not changed in 30 years, but our supportive care has changed dramatically. And we can make people feel really good going through it, so you can go to work the rest of the week. You can be a normal human being outside of the time you have to come here to do your treatments.
Here's kind of a relief. I know that sounds really crazy, but you all know me. You all see people that are better and worse than I am. And there are no errors. I mean, somebody will ask how I am feeling. There's a reason for that. So I don't feel like I have to say I'm great if I'm not. So it's very safe here.
I'm glad. That's how it should be for hopefully every place that does infusions for chemotherapy. It should feel like you're comfortable, right? It shouldn't have that nervous energy for yourself.
Well, and the fact that you come in and out all day, the whole time. I mean, I love that. That to me just says this is yours, and that you it's like your family.
Yes, we are family.
Yeah,
yes,
and it comes across, which is cool.
I've heard, Dr. Singhvi, that you personally walk your patients down to infusion whenever they have a treatment. And I love that example of just being that kind of family. It's like a lot of times you hear about the doctor came in, they saw me, and then the nurse came or the MA and took me down to, where I'm getting my chemo. But the fact that you personally walk each of your patients down there, right? That's the long-term relationship building that you're doing with people like Hillary to make them feel that safeness and that familial vibe. So I just love telling people that you do that.
I think it's a long walk. It's a long walk alone.
I loved when you explained it the first time. So the first time he walked me down, that was fine. It was the first time here. The second time he was getting ready to walk me down, and of course I had too many things to carry, and you were going to take one. I go, I can do this. And I had the mastectomy fairly recently, and so you said that in internship or residency that's when you learn to do that, and that you've done it ever since. So after that, when you walk me down, I just kind of feel proud, and I don't think about saying to you, you don't have to do that.
No, of course.
I just kind of like it.
Yes. And that's how it should be, right?
It is. It's working.
And then usually from that room to going to the infusion part, we're not talking about regular, we're not talking medical stuff. We just get to joke around about
Life.
Yeah.
I love that. I love that. I'm going to ask you both the same question and hear different answers. So Hillary, I'll start with you. Was there a pivotal moment during treatment that strengthened your partnership with Dr. Singhvi or really shifted the course of care?
It started out positive, so that was a good place to be. Certainly, when that example you just gave was huge, because it said, I'm a human, you cared, and we were in there together. So to me, that was absolutely huge. And I think the other thing is when you, the first time that I recall that you had made that recommendation, and I had said, what do you think? And you said, well, you're part of this. This is your decision. I absolutely was part of the team then. So it's your words, it's your language, and it's also the fact that you listen, and it's just so obvious, and that's so special, and it's not what you find all the time. So
it's very kind of you. Thank you.
Well, you're doing it, so I thank you. I mean, you've made it one of the highlights of going through this, and there have been positives as well as things I would prefer not to be going through, and you absolutely at the top.
I appreciate that. Thank you.
You're welcome.
What about you, Dr. Singhvi? Was there a pivotal moment during Hillary's care that strengthened your partnership with you that you remember?
I think for me, I think it's the first meeting that we have. It's the most time we spend each other is at the beginning, because we're going through this entire story of how did we get here, and what's usually when we talk about it, I outline your next 5 years for what's going to happen. I think learning about what your fears are, what you're looking for, that's the part where I think we connect the most. And from then on, we're familiar with each other. And in my memory bank, I'm like, oh yeah, that's something she doesn't want to do. I'll bring it up if I need to, but usually I'm not going to rehash that multiple times or push you on a particular topic if it's not something within your comfort zone.
Well, and you have a phenomenal memory, because the little things that you pick up from one time to three times later, it's pretty amazing.
Thank you.
So there's a lot of confidence that comes with you caring and you knowing and remembering.
Thank you.
That's how you remembered everything in medical school, right? For all your tests?
I think I think the story, the idea is like if you told the story fully, like I'm not reading off your chart at that point. You told me the story, so it's just our conversation that I remember, not.
Well, even the very first time that we met, you obviously had read who I was and what I was there for, because you used a separate piece of paper that I was going to then be able to have. You weren't going to tell me to go to my portal and print it out. So that was very meaningful, that you had taken the time and knew who I was before I got there.
Amazing. So Hillary, how has this diagnosis changed your perspective on life? Tell me a little bit about your relationships, your priorities, and what role have family, friends, or support groups played in your journey?
Well, all of those. I mean, absolutely every area has changed. So I tended to be very private, not talk about myself. Nobody would have known if I, had anything going on. And somewhere between my conversations with you and my daughter, Sid, who had gone through a cancer diagnosis, 2.5 years ago, I decided I wasn't going to be that person. So in our medical clinics, I shared with our team that what I was going through, I would never have done that before. But it opened up so many things that I would never have thought of. I mean, I would get texts on a Wednesday morning when I would be coming in here, and, you've got this. This is 11/12, or this is 4/5. And, letting people in has been absolutely huge. So I reconnected with college roommates, friends that I worked with in my first job, family that I hadn't been, you get so busy in life. So I think it's made me think about life. What's important? Where do I want to spend my time? I have no tolerance for people that are not authentic. I just really, I'm figuring I'm going to live all these years you keep saying, going forward. But just in case, I want every minute to be with people that matter. So that's been huge. And people are much more there if you let them be, It's just so, it's been an eye-opener for me. There have been a lot of positives in terms of the people I've met, both professionally and just the people that I come across. I think it's something to be shared. It's not something to be hidden or, held too tight.
Absolutely. That's a great perspective. How important, Dr. Singhvi, is it for a patient to have strong support when they're going through this?
I think some patients are lucky. I guess lucky, loved, I don't know what word to use here, but some patients have the support. Some patients don't. Right. Obviously, it eases a lot of the burdens when you have a strong support network. And it's amazing, and I'm grateful when family members, friends show up for people that are going through it. It's a huge gift. Absolutely. That and it's a reflection of you, right, as well, that you've developed all of these relationships for people to show up in, if you want to say, in your time of need or in your time of struggle. It's a reflection of you that all these people showed up. And part of that's also luck that you have those people around. I have great patients who have very little support. They're absolutely deserving as well, but that little bit of luck there didn't exist where we have it, but it makes the journey so much better to have people.
Imagine not having it. I mean, that's kind of like, and I've talked to you about other things. It's kind of like those of us that have it and that have gone through it need to be it for others. And it just really it becomes compelling.
And you're part of that now because you actually are, as you said, you're opening it up. Yeah. And I think for the rest of your life, you are going to be that person when somebody says, I haven't, I've got you, I can help.
Yeah, there's no
that's
going
your
back.
Personality. But that's your personality. You are going to help others that are needing it. So.
And Dr. Singhvi, what should women know about early detection, genetic testing, and risk factors for bilateral breast cancer?
So the risk factors are similar for breast cancer for bilateral versus, I think it's the self-exams, it's the mammograms. If you're at higher risk When you talk to your primary care, talk to your gynecologist, talk about your risks, your family history, all of that, your ancestry, all of that makes a difference in terms of calculating what is your risk of breast cancer. And, when you talk about all of that in your primary care or your gynecologist or whoever's screening you knows all that, sometimes screening doesn't begin at 40, it begins earlier, right? And sometimes screening isn't just a mammogram for patients. If you're at a higher risk, MRI gets included in that too, especially women with dense breasts. If you've got a strong family history, first degree relatives, all of those make a big difference. Genetic testing wise, all of my patients with breast cancer have genetic testing because it has both a therapeutic implication, meaning for higher risk disease, we use medications as on the adjunct side, meaning after we're done with the surgery or chemotherapy, it has an implication there. And then the other part is we're not just taking care of you, we also have to do what we can so your family members do not have to have this conversation down the road. And genetic testing has become really accessible now, and we should do it for all of our patients so we can inform their family what their risk is.
Oh, that's great advice, thank you. And Hillary, what advice would you give to someone who is newly diagnosed with breast cancer and just at the beginning of their journey?
I would tell them to try to stay as positive as possible, to think about the future and not the moment. It didn't happen to you, as you were saying, because for any reason. You shouldn't have done anything differently. So it would really be your own advocate and surround yourself by people that can be your advocate when you're not. I took people with me, mostly family, whenever I could, because I knew I wasn't going to hear it all. And I wanted to be able to discuss it and know what was going on. It was going fast, and it was going in different directions. And I'm pretty good remembering, but I knew I wasn't going to get it all. So I think surrounding yourself, and then finding some outlets that feel good. Whether for me, if I didn't walk, I didn't have a good day, and it was just like it propelled me. But certain phone conversations, making sure I stayed connected. I just don't go into a hole. Be your own advocate, and find your team.
Absolutely. And call Dr. Singhvi, apparently, is step one.
Well, yes. Yes, or call Jenny and then get to Dr. Singhvi.
And Dr. Singhvi, what continues to inspire you in this work that you do every day as a medical oncologist?
I think you've heard me say, I think oncology is the best job in the world. There are very few jobs that you get to meet somebody and very quickly we become part of the family, right?
Absolutely.
And for the rest of our lives, I am going to be part of your family, like even 10 years down the road.
Glad.
So
no divorce.
Thank you. Yes, we won't, and I think that it's one of the few jobs that lets you do that. And this is a great, when you're in early stage cancers, it's like a wonderful outcome. Most of our patients are cured, all of that. But there are others that I'm treating that we were not able to cure. But I'm also part of their journey, and my job is to ease the suffering that comes with that and then buy good quality time with them. And knowing that human aspect of it and being part of their journey together. I cry a bunch, probably every other day or every day, because I'm part of their family and I don't want to lose some of these people, and it hurts a lot.
It's got to weigh on you.
It does, and I think but it's such an amazing, amazing job to be part of people's families and take them through all this and bring the latest, one of my mentors used to say, we're getting all the base hits. I'm trying to get you to be in a spot where when the home run comes, you're ready and you're good to go. And I think that's my inspiration for my other patients, where I just want to keep you healthy and well so when the home run comes, I can put you right up at bat.
I love that.
Yeah, I like that.
So Hillary, what message of hope or strength would you like to leave our viewers with today?
An overwhelming feeling of hope. I don't know what the future is going to bring. It does scare me because mine is not like just a regular one. But I feel like I'm in really good hands. I feel confident about that. I feel every day should be a good day. It doesn't take a lot to make it a good day. So I think for everyone, it's look at the positive. You can worry about the rest of it later, but be present for your own care and the course of care, and just surround yourself with love.
Well, on that note, Thank you both so much for spending time and talking this through with me. It's really been an honor to be a part of this experience with the two of you. And thank you all for joining us on the Arizona Center for Cancer Care Cancer Now What vodcast. Hope to see you soon with more great content and more information on going through a cancer journey.